Okay, on to our next section, how personalized medicine can help improve patient care. Many patients like me members have weakened immune systems and are managing conditions like multiple sclerosis, lupus, Parkinson's disease, major depressive disorder, or chronic pain. Why should our members be excited about the advancements in personalized medicine, and how might the management of their conditions be affected by these developments? Let's turn to Dr. Ramos to find out. First, how has personalized medicine advanced our understanding of conditions like multiple sclerosis, lupus, Parkinson's, major depressive disorders, or chronic pain?
Yeah, absolutely. And I think this is really where genetics shines, and most certainly a big part of the All of Us research program. So we're in the process of rolling out that effort in terms of now taking all of those biosamples that our participants provided, whether it was blood or saliva, extracting the DNA and doing what's called genome sequencing or genome genotyping. And that provides information on that hereditary information that can speak to different diseases. And so for rare diseases, we have a tremendous amount of success in being able to identify those changes, those mutations in an individual's genome that can speak to why a particular disease or disorder is apparent for a given individual. Beyond that is, again, where the excitement comes from the All of Us research program. And really trying to get an understanding of, okay, I may have a good sense of some of the changes, some of these mutations in the genome, but it's not quite painting the full picture. Why is it that this particular medication isn't working? Or why is it that my disease is progressing faster than normal? And I think this is where we start collecting information through their electronic health record data and combing through clinical history and getting an understanding of, this was a presentation of symptoms that occurred in the last few years. And we see that as a trend over a number of different individuals that have shared characteristics. And it's really kind of turns into this almost pattern recognition that really is powered by the number of people that we have in this study. So when you're looking at one person, while you're trying to understand them at an individual level, ultimately you need a lot of people to confirm your observations. And so the fact that we now have well over 350,000, 365,000 participants, the power behind being able to answer those questions is really extremely exciting, so that we can do this pattern recognition, we can do this trend analysis and say, hey, it's not just genetics, it's all these other factors that are now contributing, that we see kind of commingling with certain diseases and commingling with certain symptoms. Again, this is what will be facilitated by the research community, by citizen scientists. That has been such a tremendous area that has pushed a lot of this this need for looking at things in a different way. And really just, again, illustrates the power and excitement of this program, personalized medicine in general.
Great. So what are some of the early successes that you have seen or expect to see that personalized medicine can deliver to people with rare diseases?
Yeah, absolutely. And so even prior to the All of Us research program, genetics really, again, has shined a light on to have a better understanding of diseases. I would say, specific to the All of Us research program, it really speaks to the challenges of building such a program to ultimately get to a point where I can rattle off 15 examples to you, and we most certainly hope to get there. But in terms of crystal balling this a bit, I'll research that I've done in the past that really kind of fell in this bucket of metabolic disorders, so type 2 diabetes. Our initial entry into this was as an example I gave prior, looking at underlying genetics as the primary driver for this disease, that it has to be some heritable component that is driving type 2 diabetes, and is really why some people have progression of disease and others don't. And clearly that hasn't been the case. And so this, and while type 2 diabetes is not a rare disease, the same approach, I think, matters in terms of how can we now look at environmental pressures, how can we now look at different layering of information, clinical background, clinical history, and really combining all of those factors to paint a clearer picture. I think that for those individuals with rare diseases, they'll start having this insight into maybe it isn't just genomics, maybe it isn't just genetics, maybe it is something that is, maybe it's my sleep that's driving this, or physical activity. That information, again, that they can take to providers and say, hey, you know, I think I fall into this category of individuals that the All of Us research program has published on in terms of insight into a particular rare disease, for example. That's exciting. You know, I can only imagine just individuals that have rare diseases, that have chronic, of which there really aren't significant treatments on. And so just even having that daylight of additional information that can really take them one step closer to improving their health, I think is tremendously exciting.
Great. So what type of time frame are you thinking about where we would begin to see personalized medicine become a reality for most conditions?
Well, we'll use the program itself as an indicator, right? So we started a few years back, we launched the All of Us research program, and we really do describe it as a decades-long effort. That doesn't necessarily mean that it's going to take 20, 30, 40 years, but it does mean that we really need to have this, what's referred to as a longitudinal lens and perspective. There's a lot that we'll glean, there's a lot that we'll see almost immediately, just because of the number of people that we have enrolled and the power that will be able to kind of push the significance of our observations. But I am hopeful that within the first decade of the All of Us research program, that we'll start seeing some meaningful contributions to the research community for a lot of questions that have been challenging the research community for decades. And so that will continue on. Some of these are, you really need decades worth of information to ultimately inform you. And obviously those will be on the tail end of this program, but I do think there will be some near immediate returns on this within the decade.
Thank you. Next question, what would you say to people living with chronic conditions who are interested in personalized medicine? What would your message be?
I think that you couldn't have a better entry point than the All of Us research program. And it's really about asking questions and understanding what that program means. And this is, again, where I think we shine in terms of making it extremely clear what the core values are of the program, how serious we are about protecting individuals' privacy and securing the data, ensuring that there is a path back to you as the participant in terms of information returned, really being upfront with what the expectations are from you as a participant in terms of the different activities that we have, and then defining and educating on the different aspects of personalized medicine. All of that is kind of captured within the All of Us research program. And I think for an individual that is looking to kind of dip their toe into that water as a potential kind of new tool to think about their health behaviors, their health outcomes, I think the All of Us research program almost gives you a one-stop shop to be able to do that.
Great. Thanks, Dr. Ramos, for explaining some of the potential benefits that patients may receive from these developments in personalized medicine. So as we move on, lastly, we will be going over some key takeaways from our conversation today and summarizing the most important pieces of information.